Should I go for it?
Karen, I think we're ready to go.
All right, great. Hello, everyone. Good morning or good afternoon, depending upon where you are today. Welcome to the Evolution of Healthcare Design and the Impact of Technology presentation. My name is Karen Burns, and I'm with my colleague, Mike Lawless. Today, we'll do some brief introductions and then discuss the evolution of HIT and design, specifically where we have been, where we are now, and where we are going. Someone will be monitoring the chat during the presentation, so please feel free to ask questions as we go along. There's also some time allotted at the end for questions. Mike, why don't you go ahead and introduce yourself and give us a little bit of your background.
Sure. Hello, this is Mike Lawless. Excited to be here. I lead one of our healthcare focused teams. I've had a really, been fortunate in my career to be engaged in just a number of really fun and innovative healthcare projects. Excited to be talking to all of you here today and excited to see what kind of questions we get during our presentations. As Karen said, feel free to ask questions as we go.
Great, thank you. Again, my name is Karen Burns. I'm a Senior Associate and HIT Strategy Executive with IMEG. I've been in the industry for about 22 years, focusing on strategic planning, vendor selections, new facility planning, and program management with a focus on clinician and end user perspective. In previous experience, I was the new facility program director for a hospital here in California. So real quick, who remembers this? If you do, please put a yes in the chat. It's hard to believe, but there was a time when if you wanted to get cash or even deposit a check, you had to actually physically go to a bank during the hours of 8 and 5 to actually interact with a banking teller, right? And then technology evolved, supporting a more flexible banking option, right? Banking anytime, but not necessarily anywhere. There were some specific locations and restrictions on locations. At some point, someone got the vision for truly flexible banking, right? The evolution of technology, the design of mobile banking, and the evolution of customers' expectations all came together for truly anytime, anywhere banking. The same evolution is occurring in the design and technology world today. Evolving technology, evolving design, and evolving customer expectations are coming together to support real change. But first, let's remember where we were. Initially, IT was really seen as a utility, not a strategic consideration. The focus was really on networking, infrastructure, and devices such as printers, computers, faxes. In some hospitals, there was even still paper medical records. It was not uncommon for building design to be largely separate from IT or HIT, and often IT was brought in towards the end of a project. Once the building was complete, maybe to discuss the location of printers, equipments, PCs, and power needs. IT was centralized within the IT department, and there was limited to no end-user input, and the decisions and discussions were definitely not focused on the experience. Eventually, though, there were changes in both design and IT. Design focused more on core building systems and innovations in design and construction. And IT was increasingly becoming a fundamental component of a hospital's functions. Improvements and changes in technology started to drive new clinical processes that had impact on design. For example, with the consolidation of inpatient systems and a focus towards integration, think Epic and Cerner, hospitals started to see an increased use of EMRs by clinicians. EMRs were starting to be used increasingly for order entry and patient care, which started to impact the patient care plan and flow on the floor, right? All of a sudden, clinicians were interested and wanted to be involved in the selection of IT systems and have more input into the physical space for clinical care, as space was needed to plan for the new computers or workstations and handheld devices and mobile units, as it was starting to impact their flow and their patient flow. Remember those days when there were computer on wheels and they were scattered all across the patient floors, or they were stuffed in closets because they weren't in use, and the floors hadn't yet been designed for storage or charging of those devices. In general, clinicians and end users were starting to want to be engaged in the design and HIT discussions. And there was also the emergence of internet-based systems, which brought increased emphasis on network and security systems, Wi-Fi systems, which started to increase the design and construction timeline, right? Making sure that we had the right equipment that was selected for implementation at the right time and was also in the budget. But there were still these conversations that were going on mostly in silos. Mike?
Yeah, and I think, when I look at this slide, I think about how we've really merged that facilities group and the IT technology groups in the hospitals we do, and how important that is, because technology is at the core of how we care for how patients are cared for. And really, on the facility side, the infrastructure, those systems need to support patient care and patient comfort. But just as importantly, they need to support the technology. It's important to get those groups together. I think it's always, as Karen talked about silos, I think it's always interesting. The last project we worked on, we're going through who's responsible for what. We got to cable TV, and everybody pointed at somebody else. Well, we identified the issue and we were able to deal with it. But getting those groups together is how you solve those sorts of issues.
Great. Thank you. Good point. Yes, that happens a lot. So where are we now? Changes in design and technology have led to great improvements in efficiencies in building design, which Mike is going to speak to in just a minute. There also have been pretty incredible advances in technology that have impacted the design of facilities, patient care, and the caregiver experience. But first, we'll talk a little bit about the design of the buildings.
Right. So as engineers, we're great at implementing, but we also want to implement the right solution. So a process that we use on all projects is rapid performance modeling. And as energy modeling and some of the data analytics we have and automation of those processes have really come along, we're able to, a new building on a new site, we're able to look at that building without any, HVAC systems and really optimize the building before we add heating and cooling and other systems to it. Before we act upon it mechanically, we're able to optimize that building. Then once we've optimized the building itself, then we can analyze different system options. And we got on buildings that already exist, we're doing renovations, we can just look at, the building might be set. Maybe we can look a little bit at the envelope, but we can look at those system options. And all that, really the goal of all that is to make the best decisions, provide that information to the owners and users early in the project so we can be, good stewards of the resources that are used to care for the patients. And once we've settled on that direction, if we go to the next slide, Karen,
sure.
Once we've settled on that direction, the next thing is, and what are we doing as far as how do we efficiently implement not only obviously the efficient MEP systems with the efficient program, the building, what kinds of things are we doing? Obviously any project has modular design, prefabrication. I mean, we did a hospital 15 plus years ago that was significantly prefabricated with a number of systems set in place even before the skin or structure was in place. And what is the reason that we do that? On tight urban sites, it reduces the number of folks on site. It allows the systems to be constructed in a temperature controlled environment where the quality is better, reduce waste. I mean, there's just a host of benefits that comes with implementing these projects using prefabrication and modular design.
IT definitely likes standardization, so this is right up our alley, right?
Absolutely.
Along with design, there have been changes in technology, right? So as design has changed, so has technology. HIT now is really considered to be an integral part of every hospital. It's in every component of providing care and running the hospital. And it really is seen as a strategic asset, able to differentiate organizations from its competitors, either as the most wired organization, or maybe one focusing on genomics, or being a pioneer in telehealth, or a world-class cancer center, or a leader in green technology and design. IT is key to the organization's ability to support and execute their strategic visions and operational goals. The design is also focused on improving experience, so focusing on people and process for the patient, the family, and the caregivers. And innovations are constantly occurring to improve the patient care experience, from biometrics at the point of registration to improve that dreaded registration process and providing the same information multiple times, to flexible contactless registration kiosks that allow for more space, especially important during COVID, and autonomy during the registration process, to mobile appointments. So just recently, one hospital went live last year with a mobile patient engagement technology. It included the ability to backfill appointments, so patients were put onto an active waiting list and were notified if an appointment was confirmed. It led to a significant increase in patient satisfaction and engagement as the organization had an increase in revenue and productivity as the facility was seeing a reduction in unfilled appointments. Pretty cool. And then lastly, there's still the emerging and evolving technology that's helping to improve patient care, from 3D printing for clinical use for braces, even aortic valves, Artificial intelligence is helping in pattern recognition and treatment of cancer to improve outcomes. And HIT is still impacting the design of facilities with things such as intelligent lighting, supporting caregivers and patients both. Caregivers really by creating a healthy environment for them to work and address issues such as circadian rhythm and improving lighting for procedures. And patients by giving them control over their environment, increasing patient safety by changing the lighting when the patient tries to get out of bed. And yet, with all of these advances, challenges still remain. There still often remains a focus on low voltage systems versus having an integrated vision or plan for the organization. Sometimes the focus is on what does the facility need to run versus what does the organization want to do with that technology. How do they want to leverage it to make it as a strategic differentiator, right? You often see common issues in not having IT at the table when a decision is made. Honest assumptions, just as Mike was referring to just a little ago, about how IT or tech or MEQ is included in which budget can happen. Common problem I've seen is some projects question which budget the cool new devices, say for Epic, that are going to be required to support the EMR, which budget are they in? Are they in the construction budget or their IT capital budget? Sometimes the Wi-Fi or the construction and cabling for Philips, GE, or biomedical equipment, is that in the biomed or the construction budget or the IT budget? And the risks of not including IT or clinicians and end users in the planning process can have some real consequences. So I remember being at a client site, walking down some hallways and seeing the computer monitors in the nursing documentation station between patient rooms were actually blocking the view into the patient room. So if the nurse was sitting and documenting on the patient chart, they would be unable to see directly into the patient room. It was somewhat obscured, right? In certain units, like most people know, the ICU has to keep a line of sight for the patient at all time. The architects and the construction team had used the standard for the design of the nursing station, which should have been fine, but they were unaware that IT and the end users had selected a larger computer monitor for the documentation. And so the monitor basically was too big and too tall for the space that had been designed. Of course, the suggested resolution was to, initially purchase all new equipment or maybe redesign the space or find a workaround, which eventually they did. Due to budget considerations, they weren't able to buy new monitors, but they were able to buy higher seats so that you could actually see over the monitor, or nurses were standing instead of sitting at the low level for the nursing documentation station. These type of silos, in terms of lack of communication between teams, can have, again, real-time consequences, and not just on the care team, but also on patients and family. A few years ago, while I was doing a walkthrough at a new facility, we learned that the hospital had to open without any cell service for patients or families. There had been confusion as to which team was contacting the vendors to coordinate the cabling and installation for the cell vendors, the cell towers, the construction team or the IT team. Unfortunately, the hospital had to open without any service, and it took several months and a lot of money and time and coordination to fix it. Another common problem we see is not including IT or MEQ early enough in the process for activation and commissioning to really provide sufficient time to test all the equipment. As with any new facility, everything needs to be tested. Each faucet needs to be turned on. Every toilet needs to be flushed. Every computer needs to be tested. All the power outlets need to be tested. All the biomedical equipment tested to make sure that it's working appropriately before the new facility is used and opened. You don't want to have any of those signs saying out of order day one. And lastly, we often still see that technology is chosen to support an existing or old process. Often the organization hasn't had the time or the bandwidth or ability to investigate new technologies that could support their new and improved patient care process or model in the new facility. For example, a new care process in a new facility was supposed to support bedside documentation, but the only computer available was outside the door or at the nursing station, as no tablets or mobile units had been included in the budget. So that care model that they had proposed to improve customer care and patient care wasn't going to be able to be supported. So where are we going? With the evolution of technology and design, we're seeing evolutions in design, evolutions in technology, and evolutions in the customer, and they're all changing. Mike's going to talk a little bit about some of the evolutions that we're seeing in design.
Yeah, thanks, Karen. I think, as we as we've gone through this presentation, I think it just reinforces how much we rely on technology, in our daily lives and to care for patients and to really function as healthcare facilities. And I think the COVID epidemic that we're going through has heightened that. How many of us now work from home? We're having a virtual conference. How flexible those systems and our infrastructure need to be. And I think as we move forward, in the healthcare setting, we're going to be, flexibility is going to be an important piece as we consider how did we adapt to the COVID changes and how do we prepare ourselves for the future. I mean, one of those things that we look at is acuity adaptability, the ability to flex rooms from typical acute care into an ICU type room should a surge occur, as we've seen in many areas around the country. And then, the situation in Texas brings up resiliency, which to me, resiliency is a number of things. It's obviously it's preparing for the typical outages, the things that might occur, but it's also, preparing for more serious events as well. And I think that many times resiliency and sustainability don't go together as often as they should. I think as we look to the future of energy, I think how much energy a building uses is going to be just as important as the peak amount of energy. So your average energy usage and your peak energy usage, I know that many areas they're already, they're billing you based on your peak energy usage more than anything else. And that brings energy storage into the equation from a sustainability aspect. And that same energy storage, when paired with a resiliency plan with alternate sources of energy like PV, can really just be a great opportunity to improve the long-term operation of your facility. And then AI. I think we all know that AI is going to become a bigger and bigger part of how things function and how buildings function. And I think a couple of things come to mind with that. One, AI is fueled by data. And where is that data coming from? I think we need to be prepared in our technology systems that we gather the data, create those databases so that as we move forward, the AI can help us to not only operate our buildings, but to build better buildings in the future using data analytics. And that goes right into the next segment is the digital twin. Once again, this is, digital twin is a virtual version of either a hospital or healthcare facility that hasn't been constructed yet or an existing facility. It can apply to either one. And the goal is to build that virtual model and then operate it virtually, determine what is the best way to either build a new building or renovate an existing building. And this, once again, this is just going to go back to data. I think many times, in all of our careers, we make a lot of decisions based on experience and our observations. And I think as we go forward, the data that's going to be available to us with actual RTLS, location of staff, movement of patients, how does the hospital actually function? I think we're going to start to be able to quantify, what we all know in some of our systems, that one healthcare facility is maybe more efficient than the other. Why? Well, I think we're going to have the data, and that's the kind of data we're going to use as part of the digital twins to really ensure that we're building and modifying these facilities the best that we can.
So the digital twin can provide real-time, in the virtual world, input back to the organization in terms of how they want to build, say, a floor or a suite or a tower, and what's the most efficient way to do it, what's the most green way to do it, or technology advanced way to do it, correct?
Correct.
That's great. I know it also can help with patient flow throughout the hospital. So optimizing transfers to like new beds, reducing wait times, and getting the patient to the right room as soon as possible. Something I know that was especially important during COVID. They were running scenarios through the digital twin to really understand what the best patient flow was on certain floors. Great, thank you. And then there's also evolving expectations. Of course, changing and evolving expectations of the customer, the patient, and the family in the hospital is changing, and the new facility design is going to have to reflect that, right? Hospitals must now design both for my 80-year-old father who can't use a computer, doesn't have a smartphone, will need assistance locating his appointment when he gets to the hospital, and most likely a wheelchair. And at the same time, plan for my 30-year-old niece, who will most likely choose her healthcare provider and organization based on their ability to let her use her phone to find her lab appointment, maybe through a digital wayfinding once she's in the facility, and like a Starbucks or a coffee on the way to her appointment, right? Key features that we're starting to see are a focus on tech-savvy solutions that still retain a personal touch, but are intuitive and easy to use. Think Apple. Something that's convenient, like Uber, but it also still needs to support the new normal of maybe contactless or touchless, or providing and supporting your own device. Organizations need to be planning ahead for this type of tailored patient engagement and interaction planning for the flow of the patient through the hospital, right? The signage needs to direct the patient, and the underlying technology such as Wi-Fi, digital signage, power, all need to be in place to be able to support those goals. But it all really starts with vision. We come back to this in terms of what does the organization want to be? What do they want to focus on? How do they want to differentiate themselves from their competitors or define themselves for their community? Is it as a smart hospital, a world-class cancer center, a green hospital, or a leader in their community in terms of wellness and outreach? Is it based on the experience for the patient, the family, or the caregiver? And remember, whatever their vision is, they still need to be focusing on outcomes, such as improved customer satisfaction scores, decreased lengths of stay, and addressing clinician concerns such as alarm fatigue. Other considerations, oftentimes we're dealing with a new facility. Other things need to still be kept in mind, such as a construction timeline and a budget. So what are some of the key themes that we're seeing for vision and engagement? One of them is trying to keep that interpersonal connection, even if the contact or the interaction is virtual or contactless, somehow making an extra effort to connect personally with each patient. It's starting to become more and more about the experience. For example, one children's hospital had installed digital art on the walls that could change based on who was walking down the floor, so you can configure it. Say, for example, a child liked an underwater theme or a Disney movie theme. The art on the walls could change as they were on their way to maybe a procedure. Even the art in the procedure room and the lighting in the procedure room can be tailored to that theme. And of course, that theme could continue to his or her room after the procedure to help with recovery. Increasingly, it's about being about the experience and supporting that experience for the patient and the family, right? And the caregivers. And of course, got to throw it in there, it still has to be uber convenient and Amazon easy. Other themes that we're seeing is a continued focus on leveraging existing and innovative technologies, big data, wearables, and even, as Mike mentioned, building automation to get real-time actionable data. Building automation systems can help monitor the heat, AC, security in real time, making cost-saving adjustments to help monitor the environment. Wearable technologies are being used increasingly for patients at home that can provide real-time data back to their provider for an illness or something they need to monitor. For example, with remote devices, you can monitor blood pressure or even blood sugar levels through alerts that go back to the provider and can even integrate with the EMR. And supporting technologies such as robotics and AI and even extended or virtual reality that can aid in improved clinical outcomes. So AI in cancer treatment is very well known. It helps identifying the right chemotherapy for treatment or model for that type of cancer. IBM Watson can do a review of thousands of clinical articles in minutes or hours versus days or months to recommend the best treatment and best outcomes for a specific illness. And virtual reality is being used to improve outcomes for physical rehabilitation, providing real-time scenarios-based clinical education for caregivers and 3D images for clinical education.
Karen, we've got a question. Have you found ways that the increased use of technology can be leveraged to support more accurate evidence gathering and then applying to the design or redesign of any modalities workflow?
Certainly. So that's part of the big data, right? So if you're able to collect that data that is bring back in, depending upon what device, and you can have that integration, then you can start to use that data to adjust either care plans or modalities, depending upon how the organization is using their big data and how they can collect it and synthesize and measure it. Yep. Good question.
That's it. That's the only question there, Karen.
Okay.
Oh, you can't see them. That's the only one so far.
Thank you. Okay, no problem. So all of these solutions have design and IT implications for IT, from networking design and bandwidth issues, application integration, as the question was just kind of applying. You want to make sure that this data is coming back and being usable, actionable, But you also have underlying system configuration issues, right? Device integration issues, and all of this takes money. So there are budget implications. And from a design perspective, you need to be looking at things for where the service is going to be located. What are the power and building requirements? What is the space design and layout for patients and caregivers? What is the flow of the care pattern? And what is the underlying technology or building requirements, cabling in the walls, power requirements, et cetera, that need to be identified to make sure that these solutions are really effective and optimized, right? So we talked a little bit about the things that we know. Here are some disruptors that are impacting the build and the design environment that we don't know what the full impact is going to be. There's some exciting trends that are still evolving. We continue to see the emergence of healthcare disruptors like Amazon, Lyft, Walmart, Uber. And these disruptors are recognized as leaders in the industry. They're seen as visionaries in their field. But we are seeing them emerge into the market, but we haven't seen the outcome yet completely of what their impact is going to be. Uber and Lyft is providing rides for patients to and from medical appointments, integration with Epic. Right? Amazon is entering into the field with pharmacy services, and Walmart is partnering with clinics for patients in remote locations. How is this going to be impacting hospitals, and how is it going to be impacting their design? Are we going to be going to see more things in satellites? We're going to see more things differentiated or broken up so that you have pharmacies, removed from the physical location of the hospital. Are you going to see a different focus on the patient care experience coming to and from the hospitals? Those things we don't know yet. What we do know is that the impact is going to be big. For example, the digital revolution, so the digital component and impact, is expected to be in the billions. And that is just one of the disruptors. So we anticipate that the impact of these disruptors is still to be determined, but we are looking at them. So what is the conclusion? What we're seeing is an increased trend. Organizations are focusing on the experience, the right patient experience, the right family experience, and the right caregiver experience for their organization. So that will certainly have an impact on the design of that facility and on IT. But the right vision is still required to achieve that organization's true goals to make the design and HIT optimal for that organization. Be it that they want to be the smart hospital, hospital of the future, the hospital with the best patient care experience, a hospital that with green technology, or the hospital that is embedded within the community. HIT and design still need to be there to be able to achieve that goal. There we go. Discussion or questions?
Well, looks like no questions so far, Karen.
Okay.
So we'll give another 30 seconds here. If we don't get any questions, we can wrap it up. No questions, Karen. So do you want to wrap it for us?
Great. Well, thank you guys. Thanks everyone for attending. We appreciate your time.